Hemorrhagic fevers. Introduction. Hemorrhagic fevers damage organs and blood vessels in the body. Select true or false. Correct. Hemorrhagic diseases happen around the world. Humans can get infected through contact with infected animals. Donna recently traveled to Africa. She has developed a high fever, muscle pain, and fatigue. She also noticed a small amount of blood coming from her ear. Should Donna contact a healthcare provider? Select yes or no. Correct. High fever, muscle pain, fatigue, and bleeding may be signs of hemorrhagic fever. Donna should visit a healthcare provider right away. Which of these can cause the spread of hemorrhagic fevers? Choose one of the following options. 1. Contact with an infected rat. 2. Having unprotected sex with an infected person. 3. Slaughtering an animal that carries the virus. 4. All of the above. Correct. Hemorrhagic fevers can spread through contact with infected animals or people. Is there a cure for all hemorrhagic fevers? Select yes or no. Correct. There is no known cure or treatment for most viral hemorrhagic fevers, but in some cases, the medication ribavirin may help prevent complications or shorten the amount of time a person is ill. Mosquitoes are very active around dusk and dawn. Select true or false. Correct. During these times of day, it is important to take extra precautions to avoid mosquito bites. Mosquitoes can transmit some types of viral hemorrhagic fever. Thank you for using Explain.